But is there any empirical evidence that suggests that they can say with confidence that there is not long-term problems with this? And how can they speak that this is the thing to do if they don't have that?
It's a great question. I think the definitive answer to that question came out a few months ago from the UK in the form of a 400-page report. And it's known as the Cass Review. And as part of that review, Dr. Cass and her team also commissioned 7 new systematic reviews of evidence and of medical guideline quality. And those systematic reviews came back with the exact same conclusion as every other systematic review that has been done on this issue to date, that puberty blockers, cross-sex hormones, surgeries, the evidence that these interventions in minors are safe and effective isn't there, which means that the risk for long-term irreversible harm is significant. There were a few other very important findings of this review. One of them being that when a child says, I'm transgender or I feel uncomfortable in my body, especially when this happens around the time of adolescence, which is when everybody feels uncomfortable in their body, there's no way for clinicians to be able to predict which of these kids will go on to have a lifelong struggle with their body. Dr. Hilary Cass concluded that youth gender medicine is, in her words, built on shaky foundations. She said that US doctors and medical associations, the very ones that you just cited, are, in her words, out of date on this issue. So we are becoming an outlier.
Yeah, and it's shocking to me that we don't have more people in the medical community standing up and saying, this is ridiculous. We can't do this to these children.
We have plenty of people in the medical profession saying that, but unfortunately they're not standing up like Ethan is. I hear from medical professionals and mental health professionals all the time. They would say, I have concerns, but if I speak out, I will be branded transphobic, and my career and personal reputation will be destroyed.
The Cass report published an online survey asking why patients detransitioned. 70% realized their gender dysphoria was related to other issues. 62% said it was due to health concerns. 50% said the transition did not help their dysphoria. 45% found an alternative to deal with their dysphoria. And nobody ever talks about this is a very painful and complex post-surgical situation. I mean, this is not an easy path.